I'm Dr. Jim Partington, and I've been working in the field of behavior analysis for over 40 years. And today I'd like to talk about some issues regarding autism treatment and try to put a little emphasis on what is effective treatment for individuals with autism. Before I do, I'd like to talk a little bit about my involvement in the field. People always ask me, whatever brought me to start working with children with autism. And I like to point out that I went to university just like most people do and didn't have a clue as to what I was going to be doing. I thought I was going to go into business, but then I found out that I really didn't like that, and I ended up taking psychology courses, and along the way I realized that I was actually studying behavior analysis from my very first class in college. And what was interesting was that I fell in love with the science of behavior and started applying the principles very early in a state hospital, and then I was offered the opportunity to start teaching children with multiple disabilities in a school setting. And once I started doing that, I learned that very quickly I just loved working with those children. And not only that, I found that I was really quite good at teaching them skills where other people were struggling to teach them skills. So that's kind of how it began. I just started working with children, started being very effective. Before I knew it, I was running my own classroom. Years go by, I finished my formal teaching. I actually have 10 years of college participation in learning behavior analysis. Got my bachelor's, master's, and doctorate all in the field of behavior analysis, in the field of psychology. And I then went on to start teaching at some universities, and I found, once again, after I started teaching to universities, that I wanted to again go back and work in the field with individuals with disabilities. And this was probably about 1981. And at that point in time, this was right before the major increase in the numbers of children with autism. Back in 1980, it was 1 in 10,000 students had a diagnosis of autism. And today, we're at 1 in 68 in the United States. So for me, when I started working in the field, I had no idea that I was going to be specializing in autism. I was a behavior analyst who was working in the field, applying the principles of behavior analysis that was derived from the science of the study of behavior. And what I found was that, once again, I was very good at doing this. However, my training was quite extensive. It wasn't just a few courses in behavior analysis. I had 10 years of actual formal classes in the experimental analysis of behavior, conceptual analysis, as well as applied behavior analysis and research methodology. So I had a quite broad range of training. And so I realized that when I come to see a family with a child with autism, I actually bring a lot to the table that's more than just basic behavior analytic knowledge. It's about families. It's about how you work with families, how you work within systems such as school systems to be effective. It's not just about working with the individual child or adolescent or adult, but rather it's working with everybody who's involved with that individual. And I have a unique set of skills, and I'm very happy with that because it's made me a very competent professional. I feel very good about the work that I do. And what I've been trying to do for many years is to try to teach others how to be effective in teaching individuals with disabilities. In working in the field, there's been so much that's gone on in terms of people now trying to meet that demand for these high numbers of individuals with autism. We have such a great number of them that there's a need for trained individuals to come in and provide what we know to be the most effective services for children with autism, which is applied behavior analysis teaching strategies. I want to point out that, again, the term ABA, which stands for Applied Behavior Analysis, is often misunderstood by families. They've heard that ABA services are what they need to get. Unfortunately, they don't often know what that means, and it means the application of behavior analytic principles to teaching strategies. In the case of individuals with autism, that is. Actually, the field of applied behavior analysis is much more than just working with children with autism. However, it is the most effective treatment for individuals with autism when it's done correctly. And I think that's a very important point, because there are now a lot of people out there who have been trained minimally to learn about the application of behavior analytic teaching methods, but don't have a wide range of knowledge in the area of counseling that may often be necessary, working with teachers within an educational environment, and even perhaps dealing with some of the family issues that may be going on that may be interfering with the effectiveness of treatment, and how to get the parents, teachers, and staff all working together to provide an effective treatment for these children. Years ago, I used to give workshops around the United States and sometimes in Canada and or Europe, and it was interesting because what would happen was people would attend my workshop, and then I'd find out years later that people were going around telling others that I had trained them in methods for working with children with autism. Well, quite frankly, I didn't even know who those people were. And one of the things that a colleague of mine, a very good friend of mine, Dr. Gerald Shook, did was he set out to establish the Behavior Analyst Certification Board. That board was intended to help consumers discriminate between people who had some knowledge of behavior analysis from those who did not. Certainly people who had just attended a 2-day workshop from me were not trained as behavior analysts. They need a lot more training than that. But yet they were able to go out and say they were a behavior analyst and start working with children, even though they were minimally trained or hardly trained at all, I'd say not trained. So anyhow, what Dr. Gerald Shook did was started the Behavior Analyst Certification Board. And that board set out some criteria for who could call themselves a board certified behavior analyst to help people discriminate between people who met certain criteria. And the criteria for that were set at a fairly minimal standard. It was one where they had to have 4 or 5 or 6 classes in behavior analysis that covered certain topics and content areas, so at least they would know the basics of behavior analysis. They would have to have some supervision by trained behavior analysts to go forward and learn how to implement good behavior analytic methods. On top of that, and the cornerstone of the certification process, is the ability to pass a test that is put out by the board, which has gone through rigorous testing for its content and validity. And that test is the main discriminator. You have to pass that test. You have to have some minimum criteria. For a board certified behavior analyst, you have to have a master's degree in education or psychology or some related field, which is felt by the board to be appropriate topic. What has happened, though, is over the years, the original group of people who were doing the certification or providing supervision were people like myself who were already doing behavior analytic work for years and applying that in the field to a wide range of individuals with autism, developmental disabilities, and so forth. But what's happened over the years is that many of the individuals who became certified through the early years then became board certified behavior analysts who could then become able to supervise other individuals in their work. Well, the people who were trained by the original group may not have had as much experience as the original group, and it kind of over time has evolved where some of the people with these minimum number of classes, minimum amount of training, are now supervising other people in the field. And so in many ways, although it's a good intent, and I think it's done a lot to help consumers at least take a look at, if a person's calling themselves a behavior analyst, do they know anything about behavior analysts? And there is a way to say yes, they know something about it. However, I think it's really important to realize, though, that many of the people who are now board certified, although that's a wonderful credential to have, may not have all the skills necessary to be effective in delivering autism treatment services. They're supposed to work within their area of expertise. As board certified, that's part of the principles, ethics for board certified behavior analysts. However, many times, because there's such a need for so many children to get services, there are many people who are out there providing services who really have not had adequate training in some of the areas. For instance, if you don't know about good assessment and program development, curriculum development, and you really don't know what it's like for a family in terms of how to work with a family to get them on board, to work with you and implement effective treatment and them being part of the team, then what may start out as good intent may not actually be effective treatment for a child. Just the other day, I was reviewing a program plan that was written by a BCBA, and quite frankly, I was appalled. The person who wrote the plan had no idea about how to work with this particular child in terms of setting the goals and objectives. And when I watched videotapes of the behavior analyst implementing the training, I realized that they wouldn't even pass my review for being able to work with children in my clinic. But yet here they were training other people, implementing procedures which were not good for the child. So, although the board certification is a good process to start looking for people who have some training in behavior analysis and get continuing education along the way, I find that there's many individuals who are actually more competent than many of the individuals who do have certification in terms of their teaching methodology. They know how to deal with behavior problems, they know how to write good curriculum and programming for children, and they know how to work with families. So I just want to point out that I'm in no way belittling the BCBA credential, but what I am saying is that does not in itself make one a good, competent professional who's able to deliver effective programming to many of the children with autism. That's point number one. Point number two is that there are many people who have had years of training in behavior analysis and those teaching methods who are really good at working with families and children and educational systems to deliver effective treatment, even though they're not certified as a behavior analyst. For years, I've been providing workshops and training around the world for educators, parents, and behavior analysts in how to work effectively in delivering educational services to children with autism. And as a result of that, one of the things that I've been doing is trying to point out to individuals what are the elements of an effective program for children with autism. Children with autism, this is their life. They've been diagnosed because they've got some abnormalities in their development. They often don't develop speech and language as well as a typical child, have some difficulty in social interactions, and often have some different types of behaviors which stand out from a typically developing child. But when it comes to looking at this child is just like any other child. You want them to be happy, you want them to learn as many skills as possible such that they can get along in life. But that means we have to take a look at what is a good program for them. Because obviously they're not developing the skills the way typical kids are, and they need some additional type of educational services. And one of those critical elements is we have to realize that we need to make sure that the child is motivated to participate with us in the learning tasks that we're arranging to teach them the specific skills to overcome some of their deficits. So we need a motivated learner who actively participates in interventions that are going to result in them learning critical skills. That being said, it's important that we identify the skills that they need to learn now that are going to be useful for them, such that they can eventually, hopefully, start to learn from their everyday interactions with others by people who haven't been specifically trained to teach them skills. For instance, their brothers and sisters, their aunts and uncles, their neighbors, and the other kids in their neighborhood. So our goal is to try to teach these kids the basic language skills and other skills that are necessary for them to be able to learn from those types of interactions. I've developed an assessment called the ABLES-R, the Assessment of Basic Language and Learning Skills Revised, which also has a web-based version of it, which makes it easy for parents and teachers to track the skills of the child, both what they have now and over time as they're developing their skills. And it has videos that demonstrate what the skills are supposed to look like and allows teachers to write programs for children very easily. There's 544 skills from 25 different areas. There's 4 main sections to it. It's got the basic language and learning skills sections. It's got some academic skills, self-help skills, and motor skills. So it's a comprehensive assessment that really looks at the key issues in a child's life. You can't leave out any of those areas. It's not just about language skills. It's really about, do they have the motor skills to participate with others? Do they have the self-help skills to take care of themselves? And of course, everybody wants the children to become literate, so we start looking at some of the educational skills. As it turns out, the ABLES-R was designed to measure skills at about the kindergarten entry level for typically developing children. I now have data on my website that people can go to and see what actual skills a 2, 3, 4, and 5-year-old child have mastered at those different age ranges. And you can compare that with the performance of the individuals on the autism spectrum, or for any disability for that matter. And it makes it easy for a teacher or parent to read because it's written in plain English for people. It's not written for my colleagues to try to have a nice technical language. I've always felt that the work that needs to be done with parents and teachers is we don't need them to learn the technical terms of a behavior analyst. They need to learn how to implement the concepts of behavior analysis such that the individuals that they're working with learn the most skills possible. So all of my work is written for parents and teachers. Easy to read, easy to implement, and again, the ABLES-R is a comprehensive assessment that allows a teacher and parent to work together on identifying the skills that a child has and that they don't have. And because the skills are put in order from simpler to more complex, it makes it easy for parents and teachers to understand what's the most effective skill to try to be teaching to a child at any one particular time. In addition to getting the child motivated to participate and actively participating in the learning process and having a comprehensive assessment to guide the teaching process, it's really important that everybody who works with the child knows how to implement effective teaching strategies. And it may seem easy for people when they watch somebody who's a good, effective teacher implementing those procedures. But it's like any other skill. Once you try to get in there and do it yourself, you're going to be asking a lot of questions and finding that it's not as easy as it looks by a trained professional. So for me, training is absolutely the key. And it's not just the instructors and the teachers, but it's also the parents and the other family members, the siblings, getting them involved in the process so that they learn how to help the individual with a disability not only learn new skills, but to ensure that they use those skills throughout all aspects of their life. It's not just about what they learn in the classroom, but it's what they can learn while they're doing their everyday activities, such as bathing, eating, toileting, grooming. These are wonderful opportunities for not only using skills, but learning new skills. So I've put a major emphasis on parent training. We want parents to know how to implement these skills. Some parents may feel a little intimidated at first by trying to do this and afraid of being a failure at it, but again, with careful coaching by competent individuals, setting the tasks up for them such that they will be successful, they can be very successful. So these are some of the major elements of an effective program: motivation, active learner participation, assessment, effective teaching methods, and involvement of all family members in the process. It's interesting because along the way, people say, you need to be patient to work with a child with autism. And I think that's fairly true, although I find myself to not be a very patient person myself, but I'm a very effective teacher. I think there's a certain set of skills that a person needs. First of all, I think people need to have the heart. I think there's two things that you need to be an effective educator. One is you have to have the heart. You have to care about the outcomes of the work you're doing. You want to see each child reach their fullest potential. I'd like to speak a little bit about behavior analysis and autism treatment. And to do so, I really need to go back in history a little bit to kind of explain where the field of applied behavior analysis came from. Basically, behavior analysts came out of the experimental laboratories. They were running experiments learning about the principles of behavior. We call that the science of behavior. There's a scientific approach to just studying behavior and how environmental influences will result in changes in behavior. And there was a lot that was learned from that. And what happened was in the late 60s, many individuals in the field began to see the implications that you could apply some of these principles, basically principles of learning, to help deal with problems that we're seeing in our society. And so from that, people started using these principles to start changing behavior for individuals who had some difficulties, such as individuals who had mental illness, and then started in with some individuals who had developmental delays. And as a result, the field of applied behavior analysis started being demonstrated to be very effective in teaching these individuals with developmental delays skills. So then into the early 70s, there was much research in terms of the application of principles of behavior to these areas of social concern. And as a result, there's been thousands of articles on how you take those principles and apply them to problems that are faced by mankind. And many of them are in the field of education, and many of them are in the field of special education. And that's the area where I've been working for many years. And what's happened is that behavior analysis has worked its way into both education as well as special education, and has now become pretty much standard, although it's implemented to varying degrees, sometimes very sophisticated ways and others less so sophisticated. However, one of the things that happened was many of the behavior analysts who were working with individuals with disabilities also then started working with some individuals with autism. And many of us who were in the field at that time found that we started getting more and more referrals for individuals on the autism spectrum because they were causing more concern for the community than some of the other children. Well, it turned out that, prior to an article coming out by Dr. Ivar Lovaas from UCLA in 1987, if a parent had a child diagnosed with autism spectrum disorder, or autism as they called it at the time, basically the pediatrician or psychologist who gave the parent the news would often say basically that there was not much of a future for this individual, that you could pretty much expect that they were going to be institutionalized, they'd never get married, they'd never hold a job, and may never talk, and so forth. It was all pretty negative. But in 1987, Dr. Ivar Lovaas published a study which demonstrated that 19% of the students that he worked with intensively, 40 hours a week, one-to-one intervention. If they started early enough, that 47% of those kids could actually make it to regular education and participate in regular education programming. Well, that was quite remarkable. When people started seeing that, they said, wow, this is hope, basically. It's hope for parents that maybe their child could be one of those 47%. So when that article was published, parents started looking for that methodology, and it was branded as being ABA, or Applied Behavior Analysis. And so many parents were then searching for this wonderful treatment called ABA, which is demonstrated to be so effective, and they wanted their child to be one of those successful individuals. But then parents often didn't know what this ABA was, where it came from, what ABA even stood for, but they knew they wanted it. And so as the numbers of children started increasing over the years, all of a sudden there's more demand for these ABA type of services. And of course, over time, the ABA services have proven to be the most effective treatment we know of for children with autism, and the demand has been growing ever since. Unfortunately, trying to keep up with the demand, we need more behavior analysts out there, and we need more teachers and parents who know about those principles of behavior analysis to be able to implement the procedures that are going to help these children develop the skills to get the most out of life. Along with that, then, you have a number of individuals who maybe have had minimal training, who are now out there trying to help this growing population of individuals with autism. And as a result, what happens is that some of these individuals have good intentions to help. But what often happens is, since they don't have a broad enough range of skills to cover all the types of problems that they're running into, they may not be as effective as they should be. And again, it's with good intention, but not necessarily with the best results. However, there's been many developments in the field of behavior analysis that have occurred since that first study showing the effectiveness of ABA programming, if you will, for individuals with autism. There's been developments in terms of how we look at the motivational variables that affect a child's participation. And I think there's been some differences too in terms of how we look at this area called expressive language, or talking, or communication. And this is where there's a difference between the traditional, what we call ABA type of services, which were based on perhaps limited range of motivational analysis for the child. Why should the child do something for us, whatever. You can certainly arrange for them to be motivated by having something that they want. But there's also taking a look at the natural environment in terms of what are some of the payoffs that occur for a child to learn and use a skill that help to maintain the child's performance, if you will, rather than just giving them things that they want right at the moment. Okay. It's not to say those methods don't work, but again, we always want to take a look at what are the natural types of consequences for our child using the skill such that it'll maintain once we've taught them the skill. We want it to be tied in with success in the natural environment, with their interactions with others. That's one piece, the motivation. Another significant change, though, has been the area that I've been working in, which is often referred to as verbal behavior. And verbal behavior is the use of a behavior analysis of expressive language to take a look at the functions of how we communicate in what we might call the expressive realm. We talk about receptive language, people understanding what others are saying to them, and expressive language, using language to talk to others, to communicate, express our needs and wants, and share experiences with them. But when you start looking at this area of expressive language, Dr. Skinner wrote a book in 1957 called Verbal Behavior. And in that book, he did a conceptual analysis of expressive language, which is referred to as verbal behavior, the name of the book. And in there, he identified functional ways of engaging what we call expressive language. We can, for instance, first we have to learn how to repeat words that others are saying, which is often referred to as a echoic. We need to be able to repeat words that other people are saying, which is often referred to as echoic responding, or we might call it vocal imitation in simple everyday language. We also need to be able to ask for things that we want and ask for information. Well, you could call that requesting, you could call it asking. Technical term is called manding. But we need to be able to use those skills to ask for things we want, including information. We also need to develop a vocabulary. We need to be able to describe things that we're seeing. We need to know the names of things. We need to be able to say what we're seeing. And this is seeing, hearing, smelling, touching, and so forth. And this you might call expressive labeling, or you might call it, in Skinner's term, tacting, in terms of how some stimuli come in contact with our sensory systems. But in addition, it's not just enough to be able to repeat words, ask for things we want, and label things, but we also have to be able to talk about things in their absence. Well, Skinner talks about this in a technical sense, and he refers to it as intra verbal. And basically, that's when one verbal stimulus, as he would say, or some words of others, if you will, result in different words being spoken or written or typed, if you will, by others. And this is called intraverbal. I just generally refer to parents as teaching about things in their absence. You know. So for instance, where do you live? Okay. You can give your address perhaps. Or say, what did you do over the weekend with somebody? Okay. Or can you tell me about a farm? And all those responses to those types of questions would be considered intraverbal responses. And certainly to carry out a conversation, you need the intraverbal skills, but you also need to be able to ask for information. You need to be able to understand what other people are saying to you, receptive language. And you have to have the ability to talk about things that are there in front of you or coming in contact with you. So what Skinner did was show us that we need all of those different types of verbal operants. And just because you have one doesn't mean you're going to have the others. And that's a key concept here. But once you have one, you can actually teach the others working off of that one, what we call verbal operant, or one type of expressive language. Well, this analysis has been used to teach specific language skills to children with disabilities. And this is what's often referred to as the verbal behavior methodology, which is often associated with ABA. So it's ABA/VB, okay? And what's particularly interesting about incorporating Skinner's analysis of verbal behavior along with traditional types of ABA treatment methodology is when talking about autism spectrum disorders, again, you're looking at individuals with language delay, social interaction, difficulties, and other types of behaviors which are considered to be abnormal. Okay. But if you start to look at it closely, the language delays play a critical role in social skills development. If you can't communicate with others, you're going to have a very difficult time engaging in appropriate social interactions with them. Furthermore, if you're not engaging in social interactions with others, you're probably going to find some other ways to entertain yourself, and that might be in some form of what other people might consider to be some inappropriate or unusual types of behaviors. So as a physician friend of mine once said, when it comes to autism treatment, you need to hit the problem head on, and head on is the language. You start there. Start there, along with the motivation for the child to want to socially interact with you in the first place. And that's why I've always said, you've got to teach language skills, but you also have to make sure that your teaching methodology results in the children wanting to interact with you. One of my catchphrases that I often use is, you want the children to run to you, not from you. So if you're using teaching methods which are not resulting in the child wanting to interact with you, you're doing something wrong as far as treatment's concerned. So again, it's a combination of teaching the expressive language and taking a look at the motivation, which now differentiates some of the treatment which is currently being done, as it's called the verbal behavior methodology, as opposed to more traditional ABA types of services. Now, in the community, there are many people, again, who may be implementing some of the methodology that's been around for many years and is somewhat effective, may not know about verbal behavior methodology. And then there's other people who say that they're implementing verbal behavior methodology, and I'd look at it and I'd say that's not at all what I would consider about how to treat a child anyhow. So just because somebody says they're doing something doesn't mean they know what they're doing, okay? Let's hope that they do, though. And I always hope that when a parent finds a practitioner, that they spend some time looking into the background of the person who's doing the work. Have they worked in this field for a long time? Are they fairly new? Maybe they're fairly new, but they're going to be wonderful, okay? But they may not be. They may have a lot to learn. And if there is a qualified professional out there, the parents want to get to the most qualified professional they can, just like you would in any other situation where you need help. And so that's where I often encourage parents to look into the backgrounds of the people who are saying they're providing services and they say they're trained, and actually find out where did they get their training, how much experience did they have, who did they work with, who trained them, and how have they been in terms of success, in terms of working with individuals. Now I will say this, that it's often difficult to compare success rates, because when you stop to look at autism treatment, all of the kids with the diagnosis of autism are different. Every one of them is different. Some of them are severely delayed in their development, and others are mildly delayed in their development. And you have to look at, if people are giving you outcome data, you have to find, how did they get those outcome data? Because many people don't have lots of outcome data. They just have good teaching services. But if they do have outcome data, were they selective in who they worked with? Because some people won't work with kids who are severely delayed and have little interaction skills or have severe behavior problems. They'll only take the more advanced type of kids, or the kids who are fairly, if you will, easy to work with compared to some of the other ones. So again, take a look at what kind of kids they've worked with. If they work with a child similar to the child that you're coming to get help for, do they have experience in those areas? 11 years ago, I was invited to speak to an international conference regarding autism in Hong Kong. And I was invited out to be the educator at the conference, to speak about effective educational methodology. People had learned of my work and were excited to have me come and present what we know about effective language training for children with autism. And what was interesting is when I was invited out, I was also invited by an agency, Autism Recovery Network, also known as ARN, by their director, Dino Trakakis, because he had set up a clinic in Hong Kong and wanted his staff to receive the most effective training that they could receive in terms of how to work with children. They clearly had the heart. They had worked with another behavior analyst at the time, but they weren't finding that the recommendations and services they were getting weren't quite what they wanted. And so Dino asked me if, when I came out to the conference, if not only would I speak there, but also would I engage in some staff training. And I presented to their staff for about 4 days. I went over the basics of teaching language to children with autism from a behavior analytic perspective. And what was interesting was I found a wide range of dedicated professionals who really wanted to help these children. And they enjoyed the training, and not only did they enjoy it, but we also had the opportunity then to show them how to start implementing those teaching strategies with the children that were participating in their clinic services. And so for the last 11 years, I've been working with the ARN staff. It turns out that I guess they kind of liked me, kept me around for a while. And I helped them develop their clinical services in terms of how it's organized, how it's run. And I've set up a monitoring system where I come out to their offices in Asia twice or more a year to provide them with training and consult with them on their children that they're working with. And when I come out there, what I've done is I've set up the system with them such that they use the WebAbles Assessment of Basic Language and Learning Skills Revised on the web, to track their children's progress, to assess and track. And so what happens is they do the assessment, they then begin the interventions using the methodologies that I've taught them to use, and then they do reassessments right before I come back. So every 6 months we do an analysis of where the kids are, what progress they've made, indications where they're still having difficulty and need to make further progress. And then I actually sit down with the parents, the teachers, and actually interact with the children in some cases, and work out procedures to try to help overcome some of the difficulties they're having in learning. And I will say this, that many of the staff who have been working there have had ongoing training and supervision by me for now, some of them as many as 10, 11 years. And they are highly competent in what they're doing. And they are highly competent in supervising and training the staff that work under them. So for me it's quite exciting because I get a chance to come back, see the children, do some troubleshooting on the programs, and also continue to educate the staff who've been there for years about more effective methods. We keep going over different issues that arise and solutions to some of the problems that they're encountering. But I also have an opportunity to directly train the online staff who are working with the children. We do video analysis of the children's skills. When we're in the clinic, we do take videos of the children, we watch what they're doing, and then usually at the end of my visit, what I'll do is a day of staff training where we pull out the videos and we go over the videos and we show the staff exactly what they're doing right and perhaps what they could be doing differently that might result in better outcomes for their students. So ARN has some very competent individuals who are running their programs and who are implementing their programs. And they've been doing it for a long time, and I feel they're doing a very effective job in their work. And on top of that, though, I think it's not just the technical aspects of what they're doing, but it's also they're a group of caring individuals who really enjoy the children, enjoy working with the children, and who really get a great deal of satisfaction out of watching the children develop their skills.